A pregnant child or teen is at even higher risk than an adult for complications or death from pregnancy. Globally, complications during pregnancy and childbirth are the leading cause of death for girls ages 15 through 19. A pregnancy in a child carries more risk for prematurity and more risk for that pregnant child. A pregnant child or adolescent faces a significantly higher risk of requiring a C-section due to pelvic immaturity. In other words, the pelvis is so small that the baby's head cannot fit through the birth canal. Pregnant children are more likely to have complications such as preeclampsia, which involves uncontrollable high blood pressure and can lead to eclampsia, which is characterized by seizures or even death. Pregnant children are usually impregnated due to rape or incest by a known relative or another adult who's close to them. Sex trafficking has also become more common since more children are online. Due to all of these complications, pregnant children have higher risks of subsequent infertility due to things like obstructed labor or damage to reproductive organs, leading to chronic infections and infertility. A child can get pregnant with their first ovulation, which can occur as young as 8 years old. This bill would not allow for any exceptions due to rape, incest, or age of the mother. Pregnant children, especially young pregnant children, do not ever result from consensual sex. An 8-year-old cannot give consent. Pregnant children are a result of rape, period. Forcing a child to deliver a child is truly child abuse. So children who are pregnant have greater health risks. Let's look at the risk to the babies of those children. Pregnant children are at higher risk of delivering preterm infants and at higher risk of having low birth weight infants. As pediatricians, we resuscitate all of these babies in the delivery room, then care for these infants in our newborn intensive care units, and then follow them in our clinics into adulthood. They often have very difficult acute conditions during their time in intensive care units, which then evolve into complicated and difficult chronic conditions, dependence on a ventilator, tracheostomy tube, G-tube feedings due to short intestines from infection, seizures, cerebral palsy due to brain bleeds. Premature and low birth weight babies are always at more risk to have behavioral issues, including seizures, autism, ADHD, learning disabilities throughout their lifetime. Premature and low birth weight infants often qualify for and require government assistance throughout childhood and frequently into adulthood because of their disabilities.